Hello, I'm Dr. Michael Keil. We're glad you're here today. We want to help you learn more about laser vision correction. We know you'll likely have some questions, both about the procedure and what you can expect. Here's a great video from TED-Ed on the history and procedures involved in LASIK.
In 1948, Spanish ophthalmologist José Ignacio Baraquer Monel was fed up with glasses. He wanted a solution for blurry vision that fixed the eye itself without relying on external aids. But the surgery he eventually devised was not for the faint of heart. Baraquer began by slicing off the front of a patient's cornea and dunking it in liquid nitrogen. Using a miniature lathe, he ground the frozen cornea into the precise shape necessary to focus the patient's vision. Then he thawed the disc and sewed it back on. Baraquer called this procedure keratomylusis, from the Greek words for carving and cornea. And though it might sound grisly, his technique produced reliable results. So, how did Baraquer's surgery work? Keratomylusis corrects what are called refractive errors, imperfections in the way the eye focuses incoming light. Ideally, the cornea and lens work together to focus light on the surface of the retina, but several kinds of refractive errors can impair this delicate system. In people with myopia or short-sightedness, a steep cornea focuses light just short of the retina. Those with hyperopia or farsightedness have the opposite problem. Light is focused too far beyond the retina. And in people with astigmatism, the cornea has two different curvatures, which focus light at two distances and produce blurry vision. Even those with perfect vision will eventually suffer from presbyopia, or aging eyes. As the proteins in the lens age, they slowly increase its size. By an adult's mid-40s, the lens is too large to easily change shape and shift focus. Glasses and contact lenses bend light to compensate for these refractive errors. But as Baraquer's procedure shows, we can also alter the shape of the cornea itself, moving the focal point backwards, forwards, or pulling a divided image together. And thankfully, modern eye surgeons can sculpt the cornea with far less invasive tools. In corrective laser eye surgery, surgeons rely on excimer lasers. These tools are accurate enough to etch words into a human hair. To safely accomplish these ultra-fine incisions, they use a technique called photoablation. This allows the lasers to essentially evaporate organic tissue without overheating surrounding eye tissue. So how does laser eye surgery actually work? The first step is to separate a thin layer from the front of the cornea. This can be done with either a flat, wide blade or a femtosecond laser that produces millions of tiny plasma bubbles to create a plane beneath the corneal surface. Surgeons then lift the flap to expose the inside of the cornea. Guided by the refractive error and the shape of the cornea, the excimer laser robotically sculpts the exposed corneal bed into the correct shape. This process usually takes less than 30 seconds for each eye. Finally, the flap is closed, and its edges reseal themselves in just a few hours. Because the lasering is done on the eyeball itself, it's described as in situ or on-site. Its complete name is laser in situ keratomylusis, but you probably know it as LASIK. Essentially, this technique carves a patient's contact lens prescription onto their cornea. Like any surgical procedure, LASIK comes with certain risks. Some patients experience slightly blurred vision that can't be corrected by glasses. But the technique is currently about as likely to damage your eyes as wearing daily disposable contact lenses for 1 year. In a technique called laser blended vision, surgeons adjust one eye to be slightly better at distance vision and the other to be better at close range vision. The difference between the two eyes is small enough that most patients can merge their vision, allowing both eyes to work together at all distances. Advances in laser technology continue to make vision correction surgery more effective and accessible. One day soon, Badaker's vision of a world without glasses may finally come true.
It's important to remember that laser vision correction is a medical procedure performed by independent board-certified doctors of ophthalmology certified in laser vision correction. Because there are different types of treatment, the healing process and level of discomfort can vary from person to person. If you have any questions, we encourage you to discuss them with your doctor. You should also be aware of some problems that are rare. There can be issues involved with making the corneal flap. In some cases, we need to reschedule treatment to allow the area some brief healing time. In some instances, some of the surface cells of the flap may become irritated or come off during the creation of the flap. These abrasions heal very quickly. Some abrasions may require the use of a bandaged contact lens to promote quick healing. Your eyes will probably be a little dry for a while after the procedure. Some people might not have dry eyes at all, while others might have dry eyes for several months afterwards. It's important to use artificial tears as directed by your doctor. Everybody's different, but this dry feeling will improve. Virtually every patient will experience some glare and halos, at least on a temporary basis, for up to 1 to 3 months due to the natural swelling of the cornea following the LASIK procedure. Other factors, such as the degree of your prescription, aberrations of the cornea, and dry eye may contribute as well. To reduce the likelihood of glare or halos, we use multiple laser technologies that will be custom matched to your eyes. These measurements taken by your doctor will determine which laser is best for you. Infections as a result of this procedure are extremely rare. Actually, there's a greater rate of infection associated with contact lens wear. It's important to adhere to the follow-up care your doctor will discuss with you and to attend your post-operative exams. As we age, usually in our early 40s, the lens inside the eye begins to lose its ability to change focus from distance to near. This is called presbyopia. Corrective lens wearers will have to either change the bifocal glasses or continue to wear contacts or wear readers as they age. Some patients, especially in the early 40s, who have laser vision correction will also have to wear reading glasses for close-up work. Ask your doctor if monovision is right for you. An additional option for some patients is ICL, or intraocular contact lens. This is typically appropriate for patients between the age of 20 to 40, who are not good candidates for LASIK or who prefer an alternative. If this is appropriate for you, your doctor will discuss it. We hope we've been able to answer many of the questions that you may have had today. We know this is a big and important decision. The more you know, the better. We want to be an important and trusted source of information for you. If you still have questions, please feel free to ask us today. And after you leave today, if additional questions arise, you can visit our website or just give us a call here at the Vision Center. We look forward to helping you enjoy a new and wonderful life without lenses.